Hi, my name is Dr. Alton Bozeman. I'm a psychologist, pediatric neuropsychology focused, and I'm the director of Menninger's Outpatient Assessments. Outpatient assessment is a full week assessment. It starts on Monday and it ends on Friday. And so it's primarily different in that it's a lot more intensive and comprehensive. So while typical school evaluation might include an education-based psychologist looking primarily at academic issues, the outpatient assessment is going to look at mental health issues in addition to academic issues if those are presenting. But it's going to look at things that might impact academics in the end, such as anxiety, depression, sleep apnea, and other aspects. So a lot of the signs and symptoms of the need or benefit of an OPA are similar to the same signs and symptoms that we tell parents and teachers to look for in general. That would include a change of behavior, or maybe like a change in friend group. That could mean either that they require new friends or that they've stopped hanging out with their old friends. And so this wouldn't necessarily necessitate the need for an outpatient assessment, but it would mean that this is maybe a time to discuss these changes with your child and investigate these concerns. Also, oftentimes talking with teachers is of benefit because oftentimes by the time we see something in our child, the teachers have seen it for a much longer time and could give you additional information and insight with that. After you have this dialogue and these discussions, then you can find out if it rises to the point of needing an outpatient assessment or an intervention. A lot of parents are concerned about labels or diagnosis, and the reminder is we're not our diagnosis, right? Those are a particular aspect that we're presenting with at that time momentarily that's presenting a challenge for us. So the main thing is to keep that in perspective and to know that with having the diagnosis and the correct diagnosis, we can get the correct interventions and help alleviate the impact that those diagnoses are having on school or in life. Yeah, so a typical outpatient assessment for a child or teen is going to include a team of a psychiatrist, a psychologist, and a team lead. That's the core team. And then in addition to that, they're going to be assigned additional medical providers or psychologists or master's level clinicians to look at specific areas of concern. That could include something like sleep or addiction or eating disorders, or things like learning disabilities or autism even. And so over the course of the week, they will meet with these individuals. And in addition, the parents will also meet with many of these professionals on their own, independent of the child, to give them the freedom to speak about what they're seeing without concerns about the child's reaction. And we'll also talk with other providers that the child has seen. And if the family wants to, we can also speak with other collaterals, such as teachers and so forth. Over the course of the week, they will keep having the sessions. Towards the end of the week, the team members will all meet to discuss our findings. The idea is we want to have a single set of diagnosis, treatment recommendations, and a single formulation. That is, how did we get here and what's maintaining it and where do we move forward from here? And then on Friday, there's a 2-hour feedback with the team leads. Sometimes the kids, depending on how old they are or how interested they are in what's going on, will attend those meetings, and sometimes they don't. And sometimes they attend part of it and the parents attend just part of it. And then on Friday, they also get the report that they can take back to their providers. For providers, the assessment's very useful because oftentimes they don't have the time to do the extended assessment portion of their interventions. And usually what a provider is seeing in the office might be pretty clear cut and pretty apparent to them, and they'll know how to go forward with treatment. Other times that question is a little bit more complex, and our assessment gives them some kind of a roadmap and guidelines as to providing the best treatment possible for the child. For parents and for schools, when we've identified things such as developmental issues such as autism, ADHD, or learning disabilities such as dyslexia or anxiety or sleep apnea that might also be school interfering, then the report gives them a guidelines as to how to target interventions to address these issues specifically. Referring clinicians will come with a couple of questions that are kind of consistent. One would be, again, like we were talking about, when the issue is very complex and they want assistance with clarity due to being limited on time or being limited on resources. Um, Other times, though, it'll be that they think that they have it, but they just want to make sure and they want to have a whole team, and it's kind of like a second opinion with the clinicians. And so that will be what they're asking for a lot of times, just diagnostic clarity. Before the assessment begins, we ask families to send us records from current treatment providers or previous providers in which there's information that they think might be relevant to the current issues. During the week, our clinicians will contact current providers if permitted so by parents, and that will help with the collaboration process and help get it started before the end of the week. In addition, they also help us because they give us information that helps us fulfill our goals of finding out exactly what's going on. A big concern that families will raise often with us is saying that their child is not very forthcoming, or that their child doesn't have enough insight to be able to speak to the issues that are going on. And so one of the things I want to always remind families and providers is that we are very trained in this. And so we have lots of specific child specialists. So we have child psychologists, child psychiatrists, and therapists. And so we're used to talking with children that aren't the most forthcoming or just sincerely aren't that insightful. And so we're used to getting them comfortable with the process and getting them to be able to talk and to open up. In addition, we're talking with the family throughout the week to fill in some of those gaps. Another concern that parents will sometimes bring up is just the fact that it's a full week and they're concerned about the child becoming overwhelmed during the course of the week. Again, I remind families that we're child trained and that we're used to this, and we've done many of them. I would want parents to consider how current treatment interventions are working for them. So, if a child has a history of not improving due to interventions and efforts, then it might mean that the diagnosis is not as accurate as it could be or as specific as it could be, and that need to target different areas. Another consideration would be just the severity of the issue and presenting problem. If it's something that seems a little bit more urgent, you might not want to take the risk of spinning your wheels or doing something that's not going to be effective and coming straight to the more intensive assessment and knowing that you're going to get the accurate diagnosis.